Welcome back to the show. On Family Day, of course, it's important to discuss family matters, and we've been doing that. And, of course, one of the matters to do with families is about childbirth and all the different ways that people are doing things nowadays. I was saying to my guest, whose name is Tasha Bodnarchuk, and I'll tell you about what she is and who she is in just a moment, but I was saying to her that when Barb and I had our 4 kids, it was all done in a pretty ordinary manner in the hospital, and that was that. You went there for a couple of days. By then, they were just beginning. This is, of course, ancient history, as you know, but when we had our first child, it was now 34 years ago, you were sort of in there still for then maybe 3 days, and then they kicked you out. I think they now kick you out in about 3.5 hours. But in any event, everybody does their own thing, and there are many different ways to do these things nowadays, including having some help before, during, and after childbirth from a doula. And that is what Tasha Bodnarchuk does. And, of course, I'd heard the word, Tasha, welcome, first of all, and thanks for joining us on Family Day. I'd heard the word, but didn't really know until I started to do some reading what a doula does. And before we even get to that, how did you even get interested in this kind of thing?
Well, it all started when I became pregnant, actually, and I had my daughter in 2011 at home in my living room. And
now, this was not one of these emergencies you see about cabs and living rooms. This was a conscious decision you made to have the baby in your living room.
Exactly.
Why did you do that?
It was a progression from the beginning of the pregnancy till I had my daughter that I imagined myself at the beginning, much like with your wife, having a baby in a hospital and with an obstetrician. And I researched and read a lot during the pregnancy and came to the decision that I wanted to do it naturally and at home. And I myself had midwives and doulas that were present at my daughter's birth.
No doctor present?
No doctor.
Okay, and not a nurse, but doulas and midwives.
Yeah, 1 doula, 3 midwives.
Now, if you go look up doula in the dictionary, which I did, and I looked at the sort of derivation of the word, it says a woman who's trained to provide support to women and their families during pregnancy, childbirth, and so on. And when you actually look up the derivation of the word, it's a Greek word, doul, which is a female slave. Obviously, that's not what's going on here, but that's just the derivation of the word. I always look these things up. What essentially are you doing and you can discuss the 3 phases, briefly of sort of before the birth, during pregnancy, at the birth, and afterwards?
Okay, yeah, exactly. It's a woman who serves, so it's bringing back that sense of community, a woman supporting another woman and her family during childbirth and labor. So I actually have 2 roles. I am both a birth doula and a postpartum doula. Mm-hmm. So first I'll talk about the birth. You're meeting with the woman and her family before the child is born, so during pregnancy, talking about ways in which they want to have this baby, relaxation techniques, if there's any concerns, any fears, working through emotional things. And then you're supporting them during the labor, relaxation, emotional support, physical support, informational support, giving clues as to what could be coming up during that process. Mm-hmm. And you're also supporting them after the baby arrives with breastfeeding support, how to integrate this child into the family, what are some stress relievers to support the family as well. And as a postpartum doula, you're going in there after the baby has arrived, and you could be working with the family for up to maybe 3 months. And you're supporting them, again, with breastfeeding, integrating the child into the family. You're also helping with maybe things around the house, small meals, laundry, giving them support. Maybe they need to have a nap and rest.
Yeah, so a lot of people don't realize how big a change it is, and certainly a lot of listeners who've been through it do. We've had a couple of new fathers around here, Robert Turner, who's on early in the morning, and also Matt Gurney, who fills in for me. And, they both talk about the fact that it changes a lot of routines around your household. The first one does, and everyone subsequent to that. A lot of people will be saying, well, all right, what's the difference between a doula and a midwife, for example? Because you mentioned that earlier when you said you had midwives present for your own childbirth. What is the difference between the two?
The difference is a doula is non-medical. So the responsibility is completely non-medical. You're providing emotional, physical, and informational support. The midwife is much like an obstetrician. They don't usually say delivering. They actually say that they catch the baby. So the doula's role is alongside that to support the woman in whatever way that she needs, and whatever way also the partner and the family needs.
Now, in order to call yourself a doula, I guess anybody theoretically could, because it's more about a role that you play and some support that you provide. But you've had obviously some training. You belong to something called Doula Care, which is meant to be an organization to sort of reassure people that there is sort of a registry of people who've done this. But how do you train? How do you get qualified in order to be able to say I'm a quote unquote a real doula?
A real doula, yes. Mm-hmm. Yes, exactly. You mentioned Doula Care. So Doula Care is an organization that you're a doula, you become a member of, mm-hmm. and you can receive training through few different organizations. The one that I'm trained with is DONA, which stands for Doulas of North America International. And there's also CAPA and a few others. And you have to do classroom training, essentially training where you're doing a certain number of hours. And then you also have to do practical experience. So you have to work with women and families during births and in the postpartum period as well.
Now, if people want to have you come in, I guess I assume most of the way you get retained by people is they find you through doula care and looking it up on the internet, sort of much as you can do research as I did. Let's say they manage to get that far. What are they going to find in terms of cost? Because people always are sort of wondering, well, gee, I'd love to have somebody like that to provide me with that support and that help both during the childbirth and afterwards, but they're wondering if they can afford it because I'm sure it's not covered by OHIP, correct?
It's not covered by OHIP,
right.
Yeah.
So
it's it ranges, actually. I mean, the beauty in it is...
Are we talking hundreds of dollars or thousands?
It could be. It could be. In Toronto, you can see sometimes birth doulas charging between... I'm going to throw it like $900 to $1,200. I've seen doulas as high as $1,500. And I know doulas that charge as low as $100-$200, maybe just for travel costs.
I think you mentioned to me before we went on, there are even some people who do it, basically for nothing on the basis that that's their way of doing some community service for a woman who needs a bit of support.
Definitely. A lot do volunteer. And that's part of being a member of Doula Care and DONA and these organizations. They actually require us to do some volunteer work. So they ask us, if you're doing this, yes, obviously you need to make a living. It is a career, but you need to also put volunteer time in as well.
I was going to ask you, one of the questions I was going to ask you is, if you look at sort of the history of childbirth, this, and you even kind of alluded to this at the beginning and said this is back to the days when people from the community, let alone your own family, would come and help with a childbirth, because of course there weren't the sophisticated hospitals with all the equipment and whatnot. And in a way, I was thinking to myself, maybe I was thinking negative, which you should never do, especially on Family Day, that, is this in fact replacing a role that family members used to play or even neighbors? But I guess it's the same concept, just a more realistic way of looking at it in 2013, that your neighbor may be off at work or not available. It's different than a small town in the 1800s. And the fact that some people will do it pro bono is the same kind of thing. It's a fellow citizen. And you may not know the person well because they may not be your next door neighbor, but they're coming to help you.
Definitely. I think it's about the sense of community again, women supporting women. It's also giving information and giving people that they have choices in birth, that they have choices and options when they're giving birth, and you're empowering people to say that this is my childbirth experience. Whether I do it in a hospital, a birthing center, at home, I can have this other person there to support my decisions and my views. I mean,
just coming back to when you said you decided to have your own baby in your living room, were you afraid? Because my fear as the father and as a husband would have been, if Barb, my wife, had decided to do that, I would have been terrified that if something went wrong, that, you're not right there with all the equipment, or if they had, like oftentimes you read these stories or hear from friends about having been sort of moved quickly into some other room where they have to perform a cesarean section, which is an operation, because they have to do that to get the baby out. How did you deal with that in your own head and just sort of rationalizing that?
Well, like I said, it was a big journey from the very beginning because I didn't think that I could do that, have my baby at home. But I read a lot. I really was looking at birth from a mental standpoint and how I could mentally focus and do that. And I really envisioned everything going positively and there being no complications. And there wasn't. I was lucky. On the other hand, I knew that at any moment, if the midwives thought that were going to be complications, that I was in good hands, and then I would have been transferred to the hospital.
And it was their responsibility, as it always would be, to sort of have the backup plan in effect. Have you found, either by way of things you've read in your studying to do this and your continuing education, if I can call it that, or also just anecdotal evidence of, because there's such an incidence you hear about of postpartum depression after birth, that the mothers get depressed for a variety of reasons. Sometimes they say it's physiological and sometimes it's just psychological. Have you found that, that where there's a doula present, that this kind of helps to lower the incidence of this happening, or at least to deal with it better?
It is. I mean, I think it's having someone present. So if the woman is having signs of postpartum, you have support there, you have someone there. And I think the other thing is a doula is really helping you to have positive feelings about your childbirth experience. And that's the biggest thing, that you're coming out of it feeling more positive. So there's less feelings of depression.
Are there people, who have negative feelings about it just because again, in the case of I shouldn't speak for my wife because she'd say, look, you didn't actually have the babies. You were there playing a limited role, which is true. But are there people who have a sort of negative feeling about the experience just because it can be very stressful? It can go on a long time. There can be pain involved depending on a lot of decisions people make. Is it for some people a sort of negative experience?
It's very common, a negative experience. And I think many times because when you're in a hospital and when there's all these interventions happening that you don't expect, a lot of women have a vision of what the experience will be like. And in the end, it's not like that. So it's about giving information. So at least if you're having a hospital birth and you have a doula, at least these are the interventions that might happen. These are the drugs that might be offered. And you feel more in control about your story and your situation.
Yeah, I sort of think about it in a way because hospitals, as much as I think they do a magnificent job here in Ontario, and there are problems, of course, but they do a magnificent job. But what they don't, they do it in kind of a clinical way. I mean, they're very nice people, usually, the doctors and the nurses, no matter what you're there for. But there's a clinical aspect to it, and nobody who's kind of saying that kind of reassuring sort of role you suggested where they're there to provide comfort and even sort of help with physical relaxation and so forth. I mean, they don't have time. I think a lot of the time they're sort of so busy running from one childbirth to the next. That they don't have time. So I can understand maybe what the role is.
Yeah, it's support, and I think again, if a woman is most comfortable in a hospital, then that's where she should have her baby, and a doula only will enhance that experience. So a home birth isn't for everyone.
Right.
Even a birthing center isn't for everyone. They want to be there with medical backup. But having that extra person there that has the knowledge and the information is really beneficial.
There's a book written about all of this. I'm sure there are many, but there's one that is titled a certain way, and I don't know whether you think it sort of aptly and respectfully sums up the role in some respects, and it's called Mothering the Mother. Mm-hmm. And is that kind of a fair, not sort of insulting or diminishing description of what a doula does?
I think it's a beautiful description. You're there to take care of the mother at one of the most important experiences in her life, and it's again, back to a woman supporting a woman, mothering the mother. And that's what we would like. DONA would like to have eventually for every woman that wants a doula, that she can have a doula. Whether if she can afford it, she can have one. If she can pay, she can have one. But if she wants it, then it's there for her.
How often are you out doing this? I mean, is it once a week, once a month? I know it depends, but
It
are you
depends.
sort of doing it quite often in a month where you'd have several different births you'd attend to and so on?
Yeah, you can have as many as you want to take in a month.
I'm a great advocate, as people know who listen to this program every day, for people having more babies. Well, the birth rate's too low here, and it is, and we have 4 children. I don't know why everybody wouldn't. I mean, I realize sometimes there's an economic reason or other reason, but why people would want to have more children than they do is a mystery to me because they're so wonderful, especially when they get older. But they're wonderful at all times. Mm-hmm. Well, it's interesting to hear what you do, and we wish you luck in doing it, and. These are things you sort of hear the words, you see it on TV or something, but you don't really understand what the function is. And we thought on Family Day it'd be a good occasion to talk about what you do and why it's important. And it seems to be something that is, being used by more people. So good luck. Tasha Bodnarchuk has been my guest. She is a doula. And you can go to look up an organization like Doula Care. Their website is www.doulacare, doulacare.ca, and it'll tell you some of the information and give you some contact information. Thanks for coming in.
Thank you for having me.
It is 5:45 on a Family Day, and that means it's still, notwithstanding a holiday, time to check on News Talk 1010 Time Saver Traffic, after which we'll have the round table. Here's the traffic.